is something that you can control. So there are two main things that influence your cholesterol. The main one is actually your genetics. So 2/3 roughly of your cholesterol relates to your genes, and that's genetically predetermined. The other 1/3 approximately relates to your diet. So you can influence your cholesterol through diet, and it's really important to do that. And again, not to try and simplify things too much, but there are actually healthy types of fats and unhealthy types of fats. So again, you can lower your risk of having a heart attack or stroke by increasing your levels of healthy fats. So simple things that I advise are to increase your levels of healthy fats that actually we know reduces the risk of thickening arteries, are things like uncooked olive oil or uncooked rapeseed oil, oily fish, so things like mackerel, salmon, and nuts, so especially things like walnuts, hazelnuts, almonds, those kind of things. I'm not talking about things like honey roasted dried peanuts. So healthy fats, more healthy fats, less unhealthy fats, so anything really saturated fats, so things like fats you find in meats, some dairy products. We know that gets converted into the unhealthy LDL cholesterol, which gets deposited within the arteries and increases that risk of having a heart attack or stroke. So that's roughly 1/3 of your cholesterol. The other 2/3 of your cholesterol, as I said, is really predetermined. But the good news is, with modern medicine, that there are medications that can lower your cholesterol and therefore lower your risk of having a heart attack or stroke. So for instance, the ubiquitous statin is a really important drug because that more or less halves your bad cholesterol overnight. So we know that if you start on a statin, your levels of that LDL cholesterol that gets deposited in the arteries will drop by roughly 40-50%. And that dropping slows down the rate that the cholesterol gets deposited within the arteries and reduces the risk of heart disease. So that's really important. And again, really you need to know what's your level of cholesterol and what's your overall risk of having a heart attack or stroke. So really what we do is when somebody comes to us, we'll get their cholesterol, we'll get their blood pressure, we'll get other important risk factors, so things like family history, and we'll work out somebody's 10-year risk of having a heart attack or stroke, which sounds quite morbid, but once we know that risk, we can have an informed discussion about lowering that risk, and that might be through lowering blood pressure, through lowering cholesterol, through lowering other modifiable risk factors, so things like alcohol, things like certain medications that increase the risk of heart disease. So that's really important, and cholesterol is so important, and a massive part of my job is having a discussion about people's risk of heart disease and focusing on how we can lower that risk. And that's why it's really important, if your cholesterol has not been checked in the past 5 years, get it checked, get your blood pressure checked, have a discussion with your GP, or go onto QRISK-2 calculator or QRISK-3 calculator online and work out what your 10-year risk of having a heart attack or stroke is. But because it's quite complex, really, the best thing to do is have a discussion with your GP.